Ms. Beck. Ms. Monet.
Chairman, ranking members, and distinguished members of the Committees on Veterans Affairs, thank you for the opportunity to join you. NCHV is the Resource and Technical Assistance Center for a national network of community-based service providers and local and state governments that serve thousands of homeless, at-risk, and formerly homeless veterans annually. We thank you for your leadership and passage of the Dole Act. We encourage you to focus on implementation of the homeless provisions within the bill. Of note, we urge you to ensure that authorizing caps and appropriations levels are sufficient to allow VA to pay for increased per diem rates authorized under this legislation and to fund Section 4201 assistance. Our written testimony includes appropriations recommendations for other critical programs. Veteran homelessness dropped to the lowest level ever recorded last year, 32,882 veterans on any given night. The 2024 HUD point-in-time count data for veterans needs a little bit of context, so I'm going to give it to you. This represents a 7% decrease since 2023 and a 55% decrease since 2009, compared with increases across the board for every other homeless population across the same time frames. While the PIT is not a perfect measure of homelessness, it's the best national measure we have for comparison's sake. We are and we have been reducing veteran homelessness consistently in the last 7 of 10 years counted. This is no mistake, as VA staff and partners across the country have dedicated time and talent towards this mission and have had the discipline to research, iterate, and implement evidence-based and other promising practices along the way. In spite of these efforts, we know that we can do more to ensure that our crisis response, homelessness prevention, affordable housing, and supportive service programs can be what veterans need, and we look forward to doing that with all of you here. Congress plays a major role in this, and my written testimony presents NCHV's priorities for your consideration. Before I dive into them, I would be remiss if I did not mention the vast uncertainty that has been created as our federal partners have moved quickly to make changes across the government. The speed and doubt that have resulted have made it hard for grantees across the country to focus on homelessness rather than issues that impact their ability to work, including the potential implications of grant pauses, shifting grant operating requirements, reductions in VA staff, including in those who serve homeless veterans, and other federal reduction in force initiatives. Further, while we're still learning more about last night's wave of contract cancellations, we know at least one cancellation was related to the Enhanced Use Leasing Program to a SDVOSB that managed oversight, including things like lead-based testing, evaluating life safety issues in these facilities, and ensuring that veterans in EUL housing get the case management that they need. We do have concerns that quality of care will falter as a result, and we urge you to work with the administration to ensure that contract cancellations do not result in adverse outcomes for veterans. These factors have really complicated the already hard work of ending veteran homelessness. And so we do want you to collectively keep your eye on everything that we've seen so far and all of the changes that we know are to come to ensure that there is minimal impact, not only to veterans, but the community that serves these veterans. VA has been an essential partner in work on veteran homelessness, and that has to continue. I'd like to pivot a little bit back to homelessness priorities, and I have 3 major ones that I'd like to discuss today. The first is HUD-VASH utilization. We need your help to ensure that VHA and PHA's, public housing authorities, are appropriately resourced, and we need you to codify federal guidance exempting VA disability compensation from eligibility requirements for HUD-VASH and LIHTC-funded affordable housing. For far too long, homeless veterans who needed assistance the most with the highest levels of service-connected disabilities were being excluded from these benefits because of their disability income. We absolutely, unequivocally support legislation that would codify this change for the program, and we also encourage the reintroduction of legislation that would codify these changes for the low-income housing tax credit program. Second, we urge you to ensure that veterans with other than honorable discharges and those who served in the Guard and Reserve without being activated can access all homeless programs. The NCHV program currently does not serve this population, and we request that you expand its eligibility criteria to make it uniform across all programs. Third, our nation's housing affordability crisis has all but guaranteed that rents are unaffordable for everyone, including veterans. In most counties across the country, economists agree that a person earning the minimum wage is not able to rent a 1-bedroom apartment without being severely cost-burdened, and we know that only 1 in 4 people eligible for Section 8 receive them because of chronic underfunding of that program. We support legislation that would create a voucher program for all extremely low-income veterans and legislation to prohibit source of income discrimination so that people can actually use these vouchers. Thank you for the opportunity to join you today. I'm open to any questions you may have.
Thank you very much.
My first question is for Ms. Monet. You have been stewarding the progress to end veteran homelessness in your years of work at the National Coalition of Homeless Veterans. And during the Biden-Harris administration, we saw homelessness reach new lows. Unfortunately, Secretary Collins seems to think this progress wasn't real. He recently told the Military Times, quote, "We have spent millions of dollars and added countless programs to the homeless situation and to suicide prevention and seen nothing," he said, end quote. Quote, "I'm ready to see results and I'm ready to take whatever we have and say, what can we do better," end quote. Ms. Monet, was the progress we saw during the Biden-Harris administration real? And to what do you attribute it? What roadblocks do you foresee arising that could prevent further progress?
So the progress we've seen was absolutely real. VA programs help hundreds of thousands of veterans every day. Well, not every day, across the course of a year, I'm sorry. But, you know, there are things that we can do to improve, and I think I laid out a few of them in my testimony today. When I think about roadblocks, I do think a lot about things that are not really tied to VA, right? We don't have a lot of affordable housing. We know that people are struggling to stay employed. We know that veterans are overrepresented in a federal workforce that is getting fired at a very rapid pace. There are these challenges that we have to contend with, and within VA, there are some things that we can do, right? We can connect services to veterans a little bit better. We can be thoughtful about prevention and how we really learn about preventing homelessness and the risk factors. There's so much that we could do, but I think that we can do it if we commit to it, right?
Yes, yes. Well, thank you so much for your response. I would like to ask Mr.
If
Lyon.
there's a freeze on the grants that serve unhoused veterans or that support that veteran permanent housing is needed, what impact do you think it would have on the ability to end veteran homelessness? And let me give you a follow-up to that. More broadly, what I'm interested in hearing is what would those freezes mean for the organizations and the communities that depend on federal resources?
So when we experienced the last freeze, it was chaotic. Organizations were sort of pushed to the brink. And a lot of them were really running numbers, looking at their budgets, thinking really intently about their cash flow, and questioning the level of commitment that the federal government has to this initiative. At NCHV, because we have a toll-free referral line, we got calls from veterans who were upset that they had been looking for housing for 3 or 4 weeks, finally found somewhere that would take their subsidy, but couldn't get their check cut because of the funding freeze. We got calls from medical center staff who said that their SSVF provider didn't have enough cash flow to cut checks for a whole community of veterans come February 1, and they were looking for other funds to support. And, you know, there were a lot of instances where our members were facing this uncertainty and trying to figure out, how do we work through this? What does this pause actually mean? What activities will be acceptable or not acceptable? And really thinking intently about that versus serving the veterans in front of them. And that's not what we want them to be doing.
Thank you, Ms. Monet.